A small Virginia town is terrorized by a mysterious outbreak. Victims rush to the emergency room. Hospitals fill with the sick and the dying. As doctors battle an invisible killer, scientists hunt for clues. Unless they can pinpoint the source of a deadly infection, many more people will die. Some of the names in this program have been changed. Virginia's Blue Ridge Mountains are peaceful. It's a safe, secure place to live. But on October 14th, 1996, something went terribly wrong. At 9 a.m., 66-year-old James Linkus was rushed to the hospital from his home in Christiansburg. As his vital signs plummeted, his fever hit 105. If they didn't make it to the hospital soon, the elderly man would die. James was taken to Montgomery Regional Hospital, where he was stabilized.
Just breathe nice and easy with your mouth open.
Dr. David Lander assessed his condition in the ER. James was a smoker. Lander knew this would make him more vulnerable to respiratory infections.
Well, he came in with a fairly typical picture of pneumonia. He had fever and cough. He was feeling weak. He also had some nausea, which sometimes happens, and his oxygen level had dropped somewhat in his blood.
Chest x-rays confirmed the diagnosis. White streaks and cloudy patches revealed the patient had a severe case of pneumonia. A large amount of fluid had built up in his lungs, making breathing difficult and painful. But x-rays alone could not show the truth. A vicious killer had already invaded the body of James Linkus. Dr. John White was on rounds when he received a page from the ER. As a pulmonologist, White specializes in respiratory disorders. He was about to take on the most complex case of his career.
Hello? Hi, John. Dave Lander here. Yeah, I have a 66-year-old fella here. He's got pneumonia. His oxygen was 87. He's got a positive chest X-ray.
Okay, that sounds pretty bad. I'll be right down. Christy, we got a bad
To an experienced physician like Dr. White, the symptoms set off alarm bells.
Pneumonia can range in severity to mild cough without even any fever, some mild shortness of breath and such, but can also kill you. It can be very severe. It can progress and involve multiple lobes of the lung until it involves an entire lung or even both lungs, and it can kill you by asphyxiation.
Pneumonia is not a disease. It is a physical reaction to a larger problem. A patient can develop pneumonia from an infection, an allergic reaction, or even from exposure to toxic substances. At this point, there was no way of knowing what had caused James' pneumonia without performing a battery of tests.
Just a little Linkus. This is the brief medicine the doctor ordered for you. I want you to try to take slow, deep breaths on this. This goes right into the lungs.
As they waited for results, a steroid treatment helped James breathe. It reduced the swelling and opened the bronchial tubes in his lungs. He was also put on antibiotics to fight any possible infection. His doctors weren't taking any chances. Pneumonia kills over 60,000 people every year in the United States. The elderly, with their weaker immune systems, are its most common victims.
I take pneumonia very seriously. Even the milder cases I've seen turn bad with appropriate treatment and turn bad in a hurry.
James Lincas was a bad case turned worse. Even with treatment, his condition spiraled downward. Oxygen levels did not increase. He was still struggling to breathe. He was transferred to intensive care for closer monitoring. In the hospital lab, a technician analyzed the patient's blood. A CBC, or complete blood count, would help rule out an allergic reaction, toxic exposure, or a viral infection as the cause of the pneumonia. Extremely high levels of white blood cells confirmed it. James Lincas had a bacterial infection, but the kind of infection would remain a mystery, with potentially deadly consequences. 2 hours later, a second patient arrived at the ER. Mary Reynolds could barely breathe. She had collapsed with dizzy spells and nausea. A few days ago, she thought she was coming down with the flu. Now, she was too weak to even stand. The symptoms were unmistakable. She had pneumonia.
Later the same morning, Dr. Lander called me again with another pneumonia case with a little note of resignation in his voice, like this is going to be one of those days.
Because Reynolds was so weak, Dr. White ordered a portable chest X-ray.
Mary Reynolds presented with a several-day history of shortness of breath, fever, cough. She had some nausea too. She was quite ill when she came in.
Taking a big, deep breath and hold it.
When the patient's daughter, Vicky Sharetta, arrived at the hospital, her mother was already in intensive care.
My father called me and said she had gotten worse. She was delirious and in pain of some kind. Very, very uncomfortable.
Vicky was terrified. Her mother had always been a healthy and active senior. Now she could barely move.
When we would try to have a conversation, she'd start out with a normal tone of voice, and then it would end up in a whisper and became very labored.
Dr. White was worried. The X-rays confirmed Mary Reynolds' diagnosis.
Our daughter, Vicky. Glad to meet you.
Nice to meet you.
How are you, Miss Reynolds?
Like James Lincas, Mary's body was fighting off an unknown infection. It was a fight they were both losing. Within an hour, a third patient arrived at the ER. He was coughing uncontrollably. He had been sick for several days with muscle aches and fatigue. His temperature had soared to 104 degrees. He was suffering from abdominal pain and nausea. His symptoms were identical to the two patients admitted earlier that day. Pneumonia rates are highest in winter. Even then, the hospital might expect to see only one case a day. Dr. White was treating 3 cases of severe pneumonia, all in one 12-hour shift.
I really got a feeling that there was more than just, this wasn't a normal call day, that there was something going on in terms of the numbers of infections that we were seeing.
The signs on each chest X-ray were unmistakable. Taken individually, each seemed like a textbook case of pneumonia. But to White, there was one recurring symptom that troubled him.
Most of these patients had nausea, and that was disturbing. That's not something that you would see routinely in large numbers of patients with pneumonia.
White feared he might be dealing with something more dangerous. Whatever it was spreading quickly. By the end of the day, he had admitted 3 more patients with the same symptoms.
And if we get any more pneumonia patients in, give me a call, okay?
Throughout the night, White was alerted as 2 more patients were admitted to Montgomery Regional. The hospital had never seen this many pneumonia patients in one 24-hour period. James Linkus, the first of the patients, was deteriorating by the hour. He was sedated and could no longer breathe on his own. Dr. White was concerned. The sheer number of cases, as well as their severity, alarmed him.
I became convinced that there was indeed an outbreak or something going on.
Following procedure, Dr. White reported his suspicions to the health department.
Hey, operator, this is Dr. White. Would you get me to the New River Valley Health Department, please?
Katrina Watson is a public health nurse with the New River Health District.
Katrina Watson?
Her experience with epidemics told her something was very wrong in Christiansburg.
Anytime there is an increased number of cases with respiratory illness, pneumonia, and no one knows what's causing that, and you have several cases, there's a possibility for community panic. There are families presenting in the emergency department. You don't know whether it will affect just children, whether it will affect adults. The last thing that you want is community panic.
I'll call you back later.
The pneumonia cases at Montgomery Regional Hospital were definitely out of the norm. She alerted Dr. Jodie Hershey, director of the New River Valley Health District. His job is to track infectious diseases, measles, meningitis, influenza, AIDS, anything that spreads and spreads quickly.
At Montgomery Regional, go on and get some line list whether there's any other.
They were looking at the first troubling signs of an outbreak.
This was the middle of October. It was not flu season. It was not what I would have expected to have been occurring at that time. So we got on the phones and we called other hospitals, we checked local doctors' offices, we checked regionally, and we found that in fact there weren't any other hospitals, doctors' offices that were seeing an unusually large number of pneumonias or upper respiratory tract infections.
The cases pointed to one source, a single point of infection. But as Dr. Hershey knew, a group of cases at one hospital could easily grow into the hundreds, unless they could stop the source. Hershey teamed up with Dr. White to scour every detail of the case files. The number of cases, the age of the patients, and even the unusual nausea, symptoms become clues when you're tracking an outbreak.
Increasing shortness of breath.
For Hershey and White, those clues would lead to a shocking conclusion. Everything pointed to a single killer, Legionella pneumophila. They thought they were dealing with Legionnaire's disease.
I was very concerned. I was really alarmed. If this in fact was Legionnaire's, Legionnaire's can make a lot of people sick very, very quickly, and it can be a killer.
Legionnaire's disease first made headlines in 1976, when an outbreak of pneumonia struck over 200 people at a Philadelphia hotel. Within weeks, 29 people were dead. Most were members of the American Legion. They had attended a convention at the hotel. After months of investigation, colonies of bacteria were found living inside an air conditioning system. The germ had been dispersed into the air and inhaled by hundreds of guests. Although the Legionnaire bacteria occur in nature, this was the first time humans had been infected. A deadly new disease was born. Now, 20 years later, people were falling ill in Christiansburg, Virginia. Doctors and health officials feared the worst. A biological predator was on the loose. How many more victims would fall ill before they could find the source of the infection and stop it? In October 1996, doctors in Christiansburg, Virginia, battled a mysterious and potentially deadly outbreak. In just 2 days, 15 patients were rushed to the emergency room of Montgomery Regional Hospital. They each suffered from the same condition: severe cases of pneumonia. Now, Dr. Jodie Hershey, director of the New River Health District, suspected they were dealing with something far more threatening: a possible outbreak of Legionnaire's disease.
If they had Legionnaire's pneumonia, we needed to know it. We needed to find out what the causes of the pneumonias were to prevent other people from coming to the hospital and being very sick.
Public health officials developed a protocol for local doctors to follow. Every patient diagnosed with pneumonia was given blood and urine tests. These samples were then sent to the Virginia State Health Lab for further testing. Mary Reynolds, one of the first patients to show symptoms, remained in very serious condition. She was not responding to the antibiotics Dr. White had prescribed. Mary was having trouble breathing. Her oxygen levels were dangerously low. When Mary's daughter, Vicky Sharetta, heard they were testing for Legionnaire's, she became alarmed.
It was quite frightening because her progress was so slow. Then when the word Legionnaire's popped up, it really got your attention.
At the New River Health District, Dr. Hershey struggled to come to terms with an outbreak that was growing larger with each passing day. He called in a team of epidemiologists, men and women specially trained to track and prevent the spread of disease.
A lot of work. I know you all are calling the hospitals. I know you all have divided up in teams to try to get information.
They systematically contacted hospitals in the area to determine exactly how many pneumonia patients had been identified. 21 cases had been diagnosed. Although Hershey suspected they were connected to the outbreak, without test results, he had no proof.
All of a sudden, in our health district, we have 20-some people in the hospital still pending results. So it was alarming.
The blood samples were sent to the Division of Consolidated Laboratory Services in Richmond. Technicians analyzed them, trying to positively identify the infection. First, they processed the blood in a centrifuge to separate red and white blood cells from the serum. This is where evidence of potentially fatal bacteria would be found. The serum was then placed on a slide with a solution added to detect if the body had been fighting Legionella bacteria. Scientists viewed the slide under a microscope with an ultraviolet light. If Legionella were present, then antibodies to the bacteria would glow green. Researchers had their answer. 4 cases tested positive for Legionella bacteria.
Hello, this is Dr. Hershey.
Dr. Hershey's theory was confirmed.
Do you have any of the others done yet?
His team was facing a full-blown outbreak of Legionnaire's disease.
Number of community-acquired pneumonias that...
To stop the outbreak from spreading, they would have to find the source of the deadly bacteria. Hershey reviewed each patient's medical history. searching for patterns.
But we need them, it's important.
Although all of the patients lived and worked in the Christiansburg area, they had little else in common.
He did have blood coat.
If they hoped to find the source, Katrina Watson knew they needed more.
It was very important to talk to patients because we wanted to find out if they shared any common experiences, because we wanted to make sure people did not continue to get ill.
Teams of medical investigators were dispatched to area hospitals to interview patients. Hershey emphasized the need for highly detailed information. He reminded them that time was not on their side.
The news of these confirmed Legionnaire's pneumonias really ramped up the investigation. We knew we were dealing with a potential killer. We knew we were dealing with a disease that could make a lot of people sick, and we knew that we very quickly had to find the source.
With a deadly outbreak threatening the region, Dr. Hershey went public with his findings. People needed to recognize the early symptoms of Legionnaire's and to understand its treatment.
We don't know what the source is. We are presently doing an investigation to try to identify the source.
As investigators searched for answers, Dr. Hershey urged the public to remain calm.
People over 50 who have some chronic underlying illness.
But with no end to the growing list of victims, panic had already taken hold. Something in Christiansburg was infecting people. Health officials had no idea what. Until they did, no one was safe. In October 1996, more than 20 people in southwestern Virginia were stricken with a life-threatening strain of pneumonia. When blood tests confirmed 4 cases of Legionnaire's disease, District Health Director Dr. Jodie Hershey warned the public. The story was breaking news on every station. 4 area hospitals were now treating patients, several in critical condition. Family and friends had no idea whether they would be the next victims.
People were afraid to go out. They were scared. They were afraid to go shopping. They were afraid to go to football games. They were afraid to go to church.
Co-workers of sick patients were especially alarmed. Local businesses asked Dr. Hershey to address employees' concerns.
There was tremendous public concern. You know, people wanted to know, how was this thing transmitted? Could I get sick? Could my children get sick?
Hoping to calm their fears, Hershey explained that Legionnaire's disease is not contagious and rarely strikes children. People over age 50 with compromised immune systems are most at risk. Only those individuals who'd come in contact with the source of the disease could become infected. Doctors at area hospitals monitored their patients closely, administering antibiotics to fight off any sign of infection. For those who responded to treatment, recovery time averaged 2 weeks. But for the elderly, fighting the infection was a slow and painful process. Mary Reynolds was one of the first patients to become ill. She had received supplemental oxygen and aggressive antibiotic therapy. Still, her condition continued to worsen. Mary's daughter, Vicky Sharetta, could only wait while her mother fought for her life.
There was a point where we did not see any improvement in her health. Maybe on some particular days even worse than the day before. And I got scared.
Each new patient in the region was tested for Legionnaire's. The state lab was overwhelmed as they tried to process all the samples. Within days, the outbreak threatened to become a public health nightmare. And still, they had no answers about the source.
It was necessary to continue to monitor the numbers of people coming to the hospital, confirm that they did or did not have Legionnaire's pneumonia, and then look to see if we could find an environmental source causing it.
Finding the source was the only way to stop the outbreak. Based on a handful of clues, Dr. Hershey suspected it was located somewhere in or around Christiansburg. He just had to find where.
Submitted on the 14th.
Okay, Chris, which hospital? I've contacted.
Legionella bacteria live in or near water. Scientists have found it in fountains and along riverbanks. Normally, small pockets of bacteria are not enough to cause infection. But in warm, moist conditions, the bacteria multiply. If large numbers of the bacteria become aerosolized, it can become infectious and deadly. There was no alternative. Hershey's team would have to identify and test every source of aerosolized water in the region. It was a huge undertaking. Hershey called in an environmental specialist, Vic Markison. Markison is an expert at investigating potential environmental factors that threaten public health.
In the very beginning, we didn't know where to look, and that's why we looked everywhere, anywhere and everywhere that aerosolized water could have come from.
The 1976 outbreak occurred because of a faulty air conditioner. Markison began by inspecting all the coolant systems in the area. The bacteria can reproduce quickly in a coolant system that is not properly maintained.
We were looking for water that contained the Legionella bacteria. As that water became aerosolized, people would inhale it, and that's how they contracted the disease. Anything that produced water under pressure was suspect.
Markison took samples of the moisture found in and around vents of the large coolant structure. The samples were sent to a lab for testing. Over the course of 3 days, the samples were cultured to see if bacteria would grow. The results were disappointing. All of the cultures were free of Legionella. Still, Dr. Hershey was certain the source was in Christiansburg. As an experienced disease detective, he moved the focus of his investigation away from the laboratory and back to the patients.
We were looking specifically to identify any common threads, any linkages between these patients. Did they have a common exposure? We were looking for a common environmental source. And if we could identify that common environmental source, then we could go in and hopefully find a pinpoint location within that source and then stop it, prevent further transmission of the infection.
Dr. Hershey brought in health officials from all over the state to administer a detailed questionnaire. They needed to know where the victims lived, where they worked and shopped, and how they spent their free time.
We had to know what was going on, where those patients had been in the 2 weeks prior to getting sick. And even though it was challenging because those people were very, very ill, we knew we had to ask the questions. We had to ask the right questions so that we could get to the bottom of what was going on.
The interviews were a slow and painstaking process, especially in the wake of a widening crisis. But team members like epidemiologist Betty Rouse refused to give up.
When we don't know the source of something that is life-threatening, potentially to a large number of people, it is a cause for emergency. It's a cause for work till the work's finished, however many people it takes to get it done.
After interviewing many of the patients, the list of potential sources began to narrow.
Some of the links began to emerge almost immediately. Locations in Christiansburg that had been visited by either all of the individuals or most of the individuals involved included such things as a grocery store and a department store and a home center.
Mary Reynolds told Dr. Hershey she had made several trips to the grocery store before she became ill. It was hard to believe that grocery shopping could cause Legionnaires. Yet something as simple as handling fresh fruit and vegetables could be the key to her illness. Under normal conditions, the water used to keep vegetables fresh is treated to kill bacteria. But an improperly maintained produce mister can provide the perfect breeding ground for deadly bacteria. An investigative team was called in from the Centers for Disease Control and Prevention in Atlanta. The outbreak had already grown too large for state health officials to handle alone. The CDC is the lead federal agency for investigating and preventing outbreaks. Their job is to track and stop deadly infectious diseases. First, they were briefed by Hershey's team of doctors, nurses, and public health officials. Next, they would inspect each of the locations. They were looking for water, or for anything that could create enough water vapor to spread the disease. Of the 3 possibly contaminated locations, the grocery store seemed the most likely. Investigators went there first, looking for signs of fine water vapor, which could be inhaled and cause sickness. They were most interested in water droplets found on a produce mister and on the vegetables sitting below. Misters had tested positive for Legionella in the past. Samples would be rushed to the CDC lab in Atlanta for analysis. It would take 3 days to determine if the bacteria in question were present. Dr. Hershey moved on to a department store, the next location on their list. He told stunned employees he needed to take water samples from their bathrooms, their water fountains, and from the central air conditioning unit.
We've been talking with Dr. Jodie Hershey from the New River Health District, and we've been talking about Legionnaire's disease.
As the hunt for the bacteria continued, the public demanded information.
All right, we do have some phone calls on the air. We'll go ahead. Good morning, you're on the air.
Yes, my boyfriend has a really bad cough, and I was wondering, is that a sign of the Legionnaire's disease?
Everyone who had a cough or a cold was terrified they had Legionnaires. Hershey did his best to maintain calm and explain the facts about the disease.
You know, the common symptoms, as we were talking earlier.
Despite his efforts, fear swept through the community. At a Montgomery County hospital, one patient took a turn for the worse. 50-year-old Paul Douglas had been in critical condition for days. Doctors fought to save his life. But on Sunday, October 27, 1996, Virginia's Legionella outbreak claimed its first fatality. Unless investigators found the source, it would not be the last.
Good morning, I'm Christine McKinnon with WFNR Continuing News. Health officials have confirmed a patient diagnosed with Legionnaire's disease who was in critical condition has died.
A deadly outbreak of Legionnaire's disease terrified a small Virginia community in 1996. With the help of the Centers for Disease Control and Prevention, District Health Director Jodie Hershey was desperately trying to locate the source of the outbreak before the bacteria claimed more lives. It had been 2 weeks since the first patients with pneumonia-like symptoms were rushed to the emergency room at Montgomery Regional Hospital. One of the first patients to contract the disease, Mary Reynolds, was still being closely monitored. For her daughter, Vicky Sharetta, the waiting was painful.
She didn't look like my mother. She was sick. She was very sick, and I had no idea that Legionnaires made you that ill.
Of the nearly 25 people who had been diagnosed with pneumonia, Dr. Jodie Hershey now had 15 confirmed cases of Legionnaire's disease. A team of doctors and public health officials worked day and night to pinpoint the source of the infection. They had narrowed their search to 3 principal sites: a grocery store, a department store, and a home improvement center. Samples taken at both the grocery store and the department store turned out negative. This left one probable source for the infection.
The home improvement center was really looking like it was the possible source of the infection. So we sent a team into the home improvement center, and we identified and pinpointed any sources of water vapor there.
Investigators scoured every department of the home improvement center. In the garden area, they tested hoses, a sprinkler system, and a decorative fountain. The home improvement center also had a hot tub on display, another potential source. In the past, hot tubs had been responsible for outbreaks of Legionnaire's disease across the U.S. Bacteria are usually found in the filter. Environmental specialist Vic Markison examined the hot tub.
We had initially gone to where the hot tubs were on display and sampled the water, tested the temperature, identified the disinfectants that were in the water.
All right. Are you ready?
The closer investigators looked, the more they were convinced the hot tub was at the center of the outbreak. None of the store employees had gotten sick, but most of them were young, with immune systems strong enough to fight off the toxic bacteria. Older customers weren't as lucky.
Hey, can you guys put the cover on?
To prevent more people from becoming infected, the hot tub was covered until the water could be analyzed. The samples, along with the hot tub filter, were sent directly to the CDC. None of the samples taken from the garden center or other parts of the store tested positive for Legionella. That left the hot tub filter. The filter was rinsed with purified water, forcing any bacteria out. The water was then passed through a specialized filter to collect the bacteria. Once isolated, it could be cultured. Dr. Barry Fields at the CDC's Division of Bacterial Diseases performed the test.
We'll put this on our media that we use to grow the organism and use a dissecting microscope to look for growth that's characteristic of Legionella.
A positive test result would not only confirm the presence of Legionella, but the exact strain. That information would be the key to unlocking the mysterious outbreak. When the test was completed, Dr. Barry Fields contacted Hershey with the results.
Hello, Dr. Hershey.
He was stunned by their findings.
Negative?
No Legionella bacteria were present in the hot tub filter.
All
or in any of the water samples.
Negative. Okay, thank you very much.
With people still getting sick, it was a huge setback. State and federal health officials knew they were racing the clock and getting nowhere fast.
And we were frustrated, we were disappointed. We had spent a lot of time testing, we had spent a lot of time in interviews, and it had pointed to the Home Improvement Center.
Hershey and his team pressed on. Despite the negative tests, the director was still convinced the Home Improvement Center was the source. His instincts told him that if the bacteria wasn't in the hot tub, then it had to be somewhere else in the store. They just had to find it. Public health officials launched a case control study. By comparing the movements of both sick and healthy people throughout the store, they would be able to pinpoint the exact location where the victims became infected. State epidemiologist Betty Rouse located subjects for the study.
What it basically involves is finding controls, that is, individuals who themselves were not ill, that matched the cases very closely by age, by sex, and by medical condition.
After scouring thousands of medical records culled from local doctors' offices, epidemiologists had a list of names. Frightened by reports of the outbreak, the public was eager to help. Members of the community submitted to a long and detailed interview. Those who had shopped at the home improvement store were asked more specific questions. When and how long did they shop? What departments did they visit? Many of the healthy people told the same story. They recalled being in the store in the weeks prior to the outbreak. They hadn't been anywhere near the hot tub display. And they were in and out of the store in less than 30 minutes. But people who had contracted Legionnaires spent over an hour in the store. They had all shopped in the area near the hot tub display. The study supported the Virginia health officials' theory a hot tub was responsible for the outbreak. But scientists at the Centers for Disease Control and Prevention could find no evidence. Nothing in the Home Improvement Center tested positive for Legionella. Still, after 3 weeks of searching, investigators were convinced they were on the right track. They needed proof, and they were running out of time. In 1996, health officials in Christiansburg, Virginia, struggled to find the source of a deadly disease. The bacteria Legionella had already killed one victim and left 15 others fighting for their lives. The most likely suspect was a hot tub display in a local home improvement center. But when test results came back negative for the bacteria, even the experts were baffled. Dr. Jodie Hershey and his team of investigators worked on.
We refused to give up. All links and all instincts pointed to the fact that the hot tub was the source of that outbreak. We went back in to the Home Improvement Center and furthered our investigation by talking to staff.
Follow-up interviews are a key part of any investigation. Often, witnesses remember more details over time. The store manager recalled something he'd forgotten to tell investigators during his first interview. After checking his records, he remembered that there were originally 2 hot tubs on display. One had been dismantled just 3 weeks earlier and sold to an employee. Health officials rushed to the employee's home. The second hot tub could have been the source. But if the employee had cleaned the tub or discarded the filter, they might not find any sign of the bacteria. They were in luck. The owner had not washed the hot tub or set it up for use. All of the parts were there. It had been sitting for 3 weeks. If the filter had dried out, there would be little chance of finding any traces of Legionnaire's disease. Remarkably, the filter was still slightly moist. It was shipped to the CDC labs in Atlanta. Dr. Barry Fields was relieved by the results.
Legionella colonies have a distinct appearance. They're white and they have a little iridescent edge around them that can be red or purple or green, so they're fairly distinctive.
Legionella was present, but that wasn't enough.
Legionella can be common in the environment, and just finding it doesn't mean that it caused disease. We've got to be sure that we found the source of the outbreak or the case that occurred.
He next tried to determine if this was the same bacteria that had made people sick in Christiansburg. DNA tests were performed on the bacteria found in the tub, as well as on bacteria infecting the patients.
What do we have?
The two samples matched. Dr. Hershey finally had proof. The source of the outbreak had been identified.
It was commendable that local, state, and federal public health officials quickly and effectively collaborated to identify the source of this mystery illness, and then got together further to avert an epidemic that could have been much worse.
For Dr. John White, the end of the outbreak brought profound relief.
It was one of the more challenging experiences of my career to have that number of pneumonia patients coming in that I felt responsible for by myself, to also feel like something was going on in the community, not knowing what it was, having more cases coming in. It was scary.
Public health officials believe Mary Reynolds and the other victims inhaled bacteria that had been growing in the hot tub for weeks. How it got there is unclear. As a result, government guidelines on hot tub cleaning and disinfection now apply to all spas, including those just on display. According to Dr. Jodie Hershey, Legionnaire's disease has changed this quiet corner of Virginia.
This outbreak has and continues to have a lasting effect on the New River Valley. It will never be forgotten. It was a scary process, an outbreak of a potentially infectious, unknown disease.
Virginia's Legionella outbreak of 1996 was the second largest in history. In all, 23 people were stricken with Legionnaire's disease. Tragically, 2 lost their lives. 70-year-old Mary Reynolds successfully fought off the disease and survived. After weeks in the hospital, she returned home to be with her family. Her recovery, and the recovery of dozens like her, was due to the hard work of a team of doctors, public health officials, and lab technicians who worked tirelessly to find and stop an invisible killer.